bad breath and gum problem. Bad breath, which an apple a day keeps patient away from doctor. A bad breath keeps everybody away from you. So normally they don't express straight away. They'll try to reduce the conversation with you and they try to shortcut. And many corporates they don't like speaking to people who get bad breath. So it's embarrassing for everyone. Now the reasons for bad breath is, number one is, the major is gum problem. Since it's painless, many patients they neglect and postpone this problem. So initial stages, you'll find only these symptoms. You bleeding while brushing. Second, food impaction after taking non-veg, chicken or mutton, or any corns or coconut. It strikes in between. And you can see swollen gums inside. So since it's painless, many patients they don't realize and they go only for scaling. So once this gum infection starts, it normally occurs because of one, if you don't clean properly, everybody says we don't have any bad habits like tobacco, or we don't take smoke, we don't smoke, or we don't have any other habits. Still our teeth are mobile, they say. The reasons for mobility is not habits. So somebody, if they don't clean properly their teeth, so cleaning is two methods. Yourself brushing your teeth twice daily and getting cleaning by dental doctor once in 6 months. So normally, however we clean, however we floss, certain amount of food particles structs below the gum, which converts as a tartar. A tartar leads to infection below the gum, which doesn't pain. It only indicates bleeding while brushing, and slowly it damages the foundation of the tooth. And then the bone deteriorates. Finally, the teeth becomes mobile, one by one becomes mobile. If somebody's teeth, one tooth is mobile, or somebody has a food impaction, using a toothpick after the meal, or bleeding while brushing, or bad breath, these are all indications for gum. Earlier, we used to treat initial stages with deep cleaning, and later stages, further severe cases, we used to treat as a gum surgery. So if the bone is not damaged, infection is initial stage, we used to use deep cleaning. The traditional process, we use instruments and scrape the infected tissue, which involves bleeding. And gum surgery, we cut and open the gum and clean everything, the infected tissue totally, and we place it, stitch it back, which is a tedious job for patient and doctor. So it used to take nearly 4 to 6 hours for total process. So if we used to operate only 8 teeth at a time or 16 teeth at a time. Then the second day we used to do the rest of the 16 teeth. So now the laser has changed the total plan. So it has become a simple it's not a tedious anymore, and no cut, no shoe, no bleeding, no injection. Earlier we used to give nearly 20 injections for gum surgery. After introduction of laser, with no more injections, we pass a thin 300 micron strip below the gum, which cauterizes the infected tissue, which makes the procedure painless, and the bad breath 100% will be free after the treatment. Only thing, further maintenance, you have to floss. That will guide you how to floss that. And you have to only come for a review after 24 hours or 48 hours once. Normally, many patients scared of dental treatment because of pain. So now it's no more injection, since it's no more patient comfortably can come. One more thing is medically compromised patients, whether it's a cardiac patient or a diabetic patient or any medically kidney transplant patients, normally they'll have swollen gums. So if the gum infection is more, the diabetics will never come down, and which creates other problems. And even cardiac patients, the more, even American Heart Association says, almost all heart attack patients there is a relation between heart problem and gum problem. The coding, they say, chromosome 9, there is an until in area chromosome 9, there is a coding. So whomever have a heart problem, when they identified, everybody has a gum problem. So when they look at the gum problem parameter, this plaque transfer through blood and deposit somewhere else, wherever there is artificial valve or whatever. It's called bacteremia, the infective endocarditis, it's called. So now earlier, for a gum surgery for a medically compromised patient, diabetic patient or hypertension patient, it used to be tedious. So since it's a bleeding is the problem, once we cut and bleeding never stops. It's because of delayed wound healing and more bleeding. So even surgeon used to avoid surgeries for diabetic patient, gum surgery. Now the process is simple. Now even an uncontrolled diabetic or a heart patient or a kidney transplant patient can get rid of bad breath and swollen gums and puffy gums and gum infection permanently with laser in just 1 hour time. We use the world's best lasers, like we have Nd:YAG, we have the highest platform in lasers, erbium laser we have, and we have diode lasers also. So you can get benefit of this and get rid of this bad breath and gum problem permanently.